Video will be talking about the blood supply of the intercostal spaces. So we know that there are 12 ribs, and the 11th and 12th ribs are known as floating ribs because they do not come all over and to the anterior, and they do not join the sternum. So, and this is the 10th rib, which we can see is joining the sternum. This is the 11th rib, and this is the 12th rib. So we can see they are not coming anteriorly and joining the sternum. So as a result, there are only 9 intercostal spaces anteriorly. So there are 9 intercostal spaces anteriorly. Let's count them. This is the first, second, third, fourth, fifth, sixth, seventh, eighth, and this over here is the ninth intercostal space. Whereas posteriorly, there will be 11th intercostal spaces. This is the first, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, and this is the 11th intercostal space. So, the blood supply of the anterior intercostal spaces come from internal thoracic artery. So first, let's see the origin of the internal thoracic artery. So this over here is the subclavian artery. The first branch given off by the subclavian artery is the vertebral artery. So the vertebral artery transverses through the transverse foramina of the vertebra from C6 to C1. So this is the vertebral artery. Now this over here is the internal thoracic artery. So this over here is the internal thoracic artery, and we can see that the internal thoracic artery, after taking its origin from the vertebral artery, is descending over the thoracic cavity medially or internally in the thoracic cavity, hence the name internal thoracic artery. Now the internal thoracic artery gives anterior intercostal arteries from the first to sixth intercostal spaces. So if we zoom in, this is the internal thoracic artery, and we can see the intercostal arteries. This over here is the anterior intercostal artery arising from the internal thoracic artery. So this over here is the first intercostal. Similarly, this is the second intercostal, and similarly it gives off the anterior six intercostal arteries. So the anterior six intercostal arteries is the branch of internal thoracic artery. Now the internal thoracic artery ends by terminating into two branches. So these two branches are musculophrenic artery. So this over here is the musculophrenic artery, and if I make this transparent, this over here is the musculophrenic artery, and is the internal thoracic artery, and we can see it dividing into musculophrenic artery over here, and this artery present over the abdomen is the superior epigastric artery. So the internal thoracic artery divides into musculophrenic branch and superior epigastric branch. Now the blood supply of 7th to 9th intercostal spaces arises from musculophrenic artery. So this over here is the musculophrenic artery, and we can see that the further branches are coming from musculophrenic artery. So these anterior intercostal branches are coming from musculophrenic artery. Now we will look at the blood supply of the posterior intercostal spaces. So we saw that we saw the two branches of subclavian artery, the vertebral artery and the internal thoracic artery. Now this branch over here is the thyrocervical trunk, but this artery is not a concern right now. The branch just lateral to it is the costocervical trunk. So this over here is the costocervical trunk. So this branch over here is the costocervical trunk. Now the first two posterior intercostal arteries come from the costocervical trunk. So we can see that this is the first posterior intercostal artery. So the first posterior intercostal artery, we can see it clearly arising from the costocervical trunk, and this over here is the second posterior intercostal artery, and we can see it arising from the second from the costocervical trunk as well. Now the third to 12 posterior intercostal arteries, like this one, they arise directly from the aorta. So we can see the third to 12 posterior intercostal arteries directly arising from the aorta and supplying the intercostal spaces. So this finishes our video on the blood supply to thorax.